STEMI clinical presentation is easy finding as the elevation myocardial infarction. STEMI is critical condition characterized by acute blockages of one of the coronary arteries, leading to ischemia and necrosis of the heart muscles. Understanding its clinical presentation and ECG findings is vital for prompt diagnosis and treatment. Clinical presentation testing, often severe and crushing, located centrally or on the left side of the chest, can lead to the left arm, neck, jaw, or back. Dyspnea, shortness of breath may occur due to reduced cardiac output or secondary pulmonary congestion and sympathetic activation, sweating, nausea, vomiting, and sense of impending doom due to activation of the sympathetic nervous system. Cardiovascular symptoms like palpitation, syncope, sudden onset of heart failure symptoms such as arrhythmia, paroxysmal nocturnal dyspnea might be present. A typical presentation like diabetes, artery, or angina may be present with atypical symptoms such as isolated dyspnea, abdominal pain, or fatigue. History findings: ST elevation, persistent ST segment elevation at the J point. Tube contagious sheet leads is a hallmark sign indicative of acute transmural myocardial injury. The extent and location of ST elevation can help localize the affected coronary artery anterior. Understanding ST elevation in AV1 to V4 suggestive left anterior ascending artery improvement LAT. Left anterior ascending inferior STEMI. ST elevation in 2 lead to with the C and AVF to suggest right coronary artery RCA or occasionally the left circumflex LCX artery movement. Lateral STEMI. ST elevation in 1 AVL V5 V6 suggests LCX or diagonal diagonal branches of LAD involvement. Pathological QAs may develop indicating by cardiac necrosis, reciprocal changes as the depression in leads, opposite to ST elevation, indicating ischemia in a distant region not directly involved in infarct. T wave changes, hyperacute T waves can precede ST elevation, and T wave inversion can occur as ST segments begin to normalize. High yield point to high yield point. Tell me only students touches high yield point. High yield point. STEMI is high time is muscle early recognition and reparation therapy either by percutaneous coronary intervention. PCI or thrombolysis are crucial in reducing mortality. STEMI equivalents certain ECG patterns such as new left bundle branch block LVVV or ST segment depression in V1 to V3 without tall R waves. Suggestive of posterior might require the same urgent treatment approach as STEMI. Reciprocal changes are an important diagnostic clue, often confirming the diagnosis of STEMI when the direct signs are subtle. Serial ECG and cardiac biomarkers like troponin are essential as changes over time can help confirm the diagnosis and estimate the influx size. Prompt identification and treatment of STEMI significantly improve outcomes, emphasizing the importance of quick and accurate interpretation of clinical ECG findings. STEMI. Next one was STEMI early treatment. Early treatment strategies. Early treatment strategies for ST elevation by cardiac infarction are crucial to restore coronary blood flow, minimize myocardial damage, and reduce mortality. The primary goal is to achieve timely reperfusion of the affected myocardial tissue, structural overload, immediate management. Will not be for initial mnemonic. Initial management although there may vary based on clinical judgment. Morphine for pain sympathetic activation reduction through its use has become more selective based on recent guidelines due to concerns about its impact on antiplatelet drugs. Oxygen Administer if SpO2 under 94% to elevate hypoxemia and nitrate sublingual nitroglycerin unless contraindicated. Right ventricular infection, hypoperfusion, use of phosphodiesterase inhibitors. Contraindication are aspirin, chewable aspirin, 160 to 325 mg as an immediate antiplatelet agent. Beta blockers like oral beta blockers within the first 24 hours unless contraindicated. Heart failure or low output states, high risk for cardiogenic shock. Perfusion therapy, primary percutaneous coronary intervention (PCI), the preferred perfusion strategy is it can be performed by an experienced team within 90 minutes. First, medical content thrombolytic therapy considered if PCI is not available within the recommended time frame. Thrombolytics are most effective when administered within the first 3 hours of symptoms onset. Adjunctive pharmacotherapy concomitants on fraction the heparin low molecular weight heparin or bivalirudin to prevent further thrombosis. Your antiplatelet therapy TAPT in addition to aspirin. P2Y12 inhibitor clopidogrel, ticagrelor, prasugrel is administered, especially important in patients undergoing PCI. Statin, high-intensity statin therapy should be initiated early to stabilize plaques and to reduce cholesterol levels. ACE inhibitors initiated within the first 24 hours in patients with STEMI, particularly in those with left ventricular systolic dysfunction, heart failure, or hypertension.